What wrong with you?
I'm having chest pains.
Okay. Nurse to check on you.
Hey Keisha, what's going on over here?
This is Jessica Wester, and she's complaining of chest pain.
Hey Jen, I'm Angela. I'm gonna be your nurse today. Nice to meet you. Tell me about your chest pain.
I'm having a little sharp pains in my chest here. Feels like someone's kind of sitting on my chest.
On a scale of 1 to 10, how bad is it? With 10 being the worst.
It's about an 8, 9.
Okay, as I'm approaching the patient, I'm gonna look at her. I'm gonna look at her rate of breathing. I'm gonna look at her abdominal muscles to see how easy it is for her to breathe. I'm looking at her skin to see if she's sweaty and diaphoretic. I'm gonna look at her nail beds, at her capillary fill. I'm gonna look around her lips and see if there's any a blue tinge for cyanosis. Jan, tell me more about your chest pain. How long have you been having it?
I've been having it for a couple hours now.
You have? Have you ever had this pain before?
Nothing more than just like a heartburn.
That it feels. Have you ever had heartburn before?
Yes.
Is it mimicking
No,
heartburn or is it different?
It's about something like a heartburn, but it's worse.
Okay. What makes it worse?
It's just the pain.
Just the pain?
And it feels more pressure.
Feels more pressure today. Okay. All right. So I'm going to do a cardiac assessment on her, and I'm going to listen to her heart sounds. The first one I'm going to listen to, I'm going to go over here to her right side, and I'm going to look for her clavicle and go down two spots to her aortic, and I'm going to listen to her. Now I'm going to go over to her left side to her clavicle. I'm going to go down 2 spots, and I'm going to listen to her. I'm going to go to, it's going to be PETA. The first one's going to be P for pulmonic. I'm going to go down to the 3rd spot, the midclavicular line, and it's going to be Erb's point. And then the 4th spot, the midclavicular line, is going to be tricuspid. And then I'm going to go to the 4th spot, which is going to be the aortic, or the point of maximum impulse, and listen. Okay. Then I'm going to use the belt of my stethoscope and listen to all the spots again. We'll go to aortic. Sorry. Pulmonic. Erb's point. Tricuspid, and aortic. Now I'm also going to look at her jugular veins to see if they're distended, and that's also a sign. I'm going to get a flashlight. Jan, can you turn your head to the side, please? Okay. No distension here. Let's go to the other side. Perfect. I'm also going to get my stethoscope and listen to her carotids, because that could tell me that she might have a blockage on each side. And I'm going to use the bell also to listen. I'm listening for a bruit or a turbulent blood flow, which could signify that blockage. I'm going to look at her legs, see does she have any swelling in her legs. Jan, do you know where you're at today?
Yes.
Where are you at?
I'm at the hospital.
What's your date of birth?
1/16/91.
And I'm asking her questions that I can answer. So I'm going to look on her wristband to see what her date of birth is. Who's the President of the United States?
Donald Trump.
Okay. This completes my cardiac assessment. Thank you for being my patient. And that concludes our assessment.